There's a weight that surgeons carry that almost nobody talks about. It's a kind of hidden grief. Not a grief from tragedy, not grief from a case gone wrong or a patient lost. Actually, it's grief from erosion. The slow, systematic erosion of the surgeon you trained to become. Today, I'm going to name it because I carried it for years before I understood exactly what it was. I'm Tyler Goldberg. I'm an orthopedic surgeon with 25 years of experience and more than 12,000 joint replacements. I carried this grief for a long time before I named it. The research on physician moral injury gave me the language I was missing. But the research only goes so far. And today, I'm going to tell you what it actually feels like. I think you already know. You just have not had the permission to say it. The grief I'm talking about is not dramatic. It is not the grief of a patient dying on the table. That kind of grief has a name too. It has rituals. It has support structures. This is a quieter grief, and it accumulates. It's the grief of lost time. You trained for years to be present with patients, and now you have 15 minutes to explain a life-changing surgery, answer questions, build trust, and document everything. 15 minutes. It is the grief of lost identity. You became a surgeon because you wanted to be a craftsman, someone who operates with precision, intention, and care. And the system turned you into a production unit, a line item, a provider. It is the grief of lost autonomy. You used to decide how to practice. Now your schedule is decided by administrators. Your case mix is decided by referral patterns and payer contracts. Your time is decided by a productivity target that somebody else set. It's the grief of lost presence. You're physically in the room with a patient, but your mind is already on the next case, the next chart, the next authorization that you're going to have. You're there, but you're not really there. It's the grief of lost margin, not just the financial margin, the margin in your week, the space between cases where you used to think, to plan, to breathe. That margin is gone. It's compressed by volume, documentation, and relentless acceleration of the production model. It's the grief of lost pride. You are capable of extraordinary work. You know what your outcomes could be if the system gave you room to get those outcomes. And you grieve the gap between what you deliver and what you actually could deliver. That is the grief of lost excellence. Not personal failure, lost excellence. And it's the grief of lost connection. To patients, to colleagues, to yourself, to the version of yourself that walked into residency believing this profession would be different. This grief sounds like this. This is not what I imagined. I know what I'm capable of, and it's more than this. I know I'm capable of more presence than this. I miss the surgeon I used to be. How many of us have said that? I miss who I used to be. Let me explain why this grief gets buried and why burying it makes everything worse. Surgeons are trained to be stoic. From day one of residency, the message is clear. Push through. Don't complain. Don't show weakness. The patient needs you strong, your team needs you steady, and your partners need you reliable. So you bury it. And that buried grief does not disappear. It transforms into irritability. What do? You snap at your team. You get frustrated with patients who ask too many questions. You lose patience with your family at the end of the day. It transforms into emotional fatigue. You come home and you have nothing left. Not because the surgery was hard, but because the emotional compression of the entire day drained everything from you. It transforms into detachment. You stop caring about the individual patient and start processing cases. Not because you're a bad person, because detachment is the only way to survive the endless volume that comes your way. It transforms into cynicism. You start to resent the system, the administrators, the payers, sometimes even the patients, because the grief has nowhere else to go. And that transforms finally into numbness. And that's the most dangerous one, where you stop feeling the grief entirely, where you just go through the motions, where the craft that used to light you up just becomes a job that you endure. Here's why this matters clinically. A surgeon operating from a state of accumulated grief is not operating at their best. The research is clear. Physician burnout correlates with increased medical errors, decreased patient satisfaction, higher complication rates, and a lower quality of life for the surgeon themselves. This is not just an emotional problem, it's a safety problem and a patient safety issue. And no wellness committee email is going to fix that. The common mistake I see is surgeons trying to solve the problem through work optimization. Work faster, be more efficient, batch your notes, outsource your documentation. Those are not really solutions. They are just accommodations to a broken model. You can't optimize your way out of grief. You can only address it at its source. So what does addressing it at its source look like? Well, it looks like alignment. A practice model where the things you value are actually reflected in how you spend your time. Time with patients. That means consultation slots long enough to have a real conversation. Not 15 minutes, 30, maybe 45. However long the patient and the situation need is how long you'll spend with them. How about presence in the OR? That means a case schedule designed for quality, not throughput, where you have time to plan, review, and operate without the next case breathing down your neck. How about identity as craftsman? That means being valued for your expertise, your judgment, and your outcomes, not for the speed and/or your volume. How about margin in your week? That means space between the clinical work for thinking and planning and recovery and the life that's outside the hospital. Concierge Orthopedics gave me a pathway out of that quiet grief and back into myself. And I want to be specific about what changed for me. My volume did go down. By design, I see fewer patients and I spend more time with each one of them. The patients I see are qualified for concierge care and they value the time and attention. My surgical planning improved because I have now time to review imaging properly, discuss expectations thoroughly, and plan each case with the attention that it deserves. These are life-changing operations. We can afford to spend a few minutes planning them. My post-operative relationships deepened with my patients because I follow patients now through the recovery process personally instead of just handing them off to a system. And something I did not expect, my energy came back. Not because the work got easier, but because the work finally aligned with why I became a physician and a surgeon in the first place. If any of that I've described sounds familiar to you, the hidden grief, the erosion, the gap between who you are and how you practice, there's a way to measure it. I built a 6-question orthopedic practice assessment that will show you where the misalignment lives in your practice. It only takes 2 minutes and the results are personalized. The link is in the description below and it's pinned in a comment. Now, let me tell you a part that most people miss. The hardest part of grief is not the grief itself, it's the loneliness of it. You cannot talk about it with your partners because they are carrying the same weight and nobody wants to be the first to name it. You cannot talk about it at home because your family sees the income and the title and wonders, what the heck do you have to complain about? So you carry it alone and you wonder if something is wrong with you. Nothing is wrong with you. If you have felt this erosion, this quiet sense of losing parts of yourself to a system that does not care about the parts it's taking, you're not imagining that. It's real, and you're not alone. There's a community of surgeons who are working through this. Some are early in the process, some have already built differently. Some just need to know what they feel has a name. That community is in the link in the description below. I'm Dr. Tyler Goldberg. Build something worth operating in.